So recently we are seeing a lot of heart attacks which is happening under 40 years, and the question always remain, if the person is young, person is not having any risk factor like genetical diseases which run in the family, no smoking, no even alcohol, teetotalers are getting heart attack. So where we are missing? And the answers come from the previous whatever the lifestyle what we are taking, the sedentary lifestyle, the food habits, the time of the food, and what type of food we are consuming over the time. Sitting is a new smoking which we all know, but in practice most of the people say that we are working hard, we are having day in and day out activity at our place, but it is not going to equate with the sedentary life which 5 days in a week everybody who are in the corporate sector they are doing. Secondly, the persons who are having a night shift, means they are working whole night and at the same time consuming the snacks in between or even taking the meals in the night, is not a good habit. Third, the pollution what we are facing, particularly who are staying in the metros, the nanoparticles which we are inhaling, they are also pro-inflammatory and they bring a lot of inflammation in the vessels. Fourth, the water what we are consuming, the pesticide levels which are being imbibed in that one, the RO water, the heavy and soft water concept which is taking a toll. Some water is not at all, I mean, like what we are saying RO water, it is taking a lot of minerals out of this one which is essential, and that is preventing the inflammation in the vessels are also taken out with that. And finally, the consumption of plastic, the plastic which is invisible either in the form of the plastic bottles which is being used, or the food which we are consuming which has been packaged later on been delivered at our places. If you are going to see the plastic level of the food, you will be amazed how much it is increased. So these are the invisible non-traditional risk factors which are floating all over but still invisible to the media, and people are not working how to prevent it, because this over the time when accumulates it gives an inflammation which is been invisible, and these are going to give the inflammation which is reflecting in the attacks or silent heart attacks or cardiac arrest, which is a part of the heart attack story. So thank you so much. We will see you next time with some new topic.